terms of the budget. And unfortunately, when that happens, then a lot of people don't get the benefits they're eligible for, what they're entitled to, what they paid for in all those years. So this is what I'm doing in my semi-retirement. I was gone a few days. I'm back now. And so this is going to be a long one today. I'm going to talk about how you can make sure you don't get overpaid or underpaid. You're just like, overpaid. Oh, I always like overpayment. They eventually catch it. So let's go through the list, and then we've got a live Q&A. I'll open it up for the rest of the hour and answer as many of your specific questions as possible. And then I've also got a bunch of video questions that were sent in about retirement, disability, working, spouse benefits, and all the rest of it. So we'll try to get as much as humanly possible today. So everybody says, welcome back. Well, thank you very much. I appreciate it. Nice to have a few days off, but here we go again. Okay, so Elon Musk and everybody, they took their chainsaw to Social Security and cut thousands of employees. People are still leaving. One of my closest associates when I worked at Social Security, he just retired a few days ago, and Social Security lost one of the best people they had when he decided to retire early, because he was tired of the chaos. He loved the agency. A lot of these Social Security employees love the agency. And they were kicked out, or they just said, yeah, it's not going the way it's supposed to go. And as you saw in my thumbnail for this video, we're talking about Trump cuts to Social Security. But I also put all those other presidents on there as well, because this isn't something new that just started happening with Doge and the current administration. This has been going on for a long time. This was a plan by those that don't want Social Security to be around anymore. They want to give those trillions of dollars to Wall Street, their Wall Street buddies, so they can, get their golden parachutes and all the rest of it. So this has been a plan that's been, hatched back in the 1980s to slowly deteriorate the agency. And now it's coming to fruition. Now it's on steroids. You call Social Security, maybe you're on the phone for about 3 hours, and then if they pick up, it's usually one of those AIs that's picking up. And I've called a few times just to check, and it's giving out incorrect information, the wrong information. It gets you in this terrible loop, and you can't talk to anybody. If you file online, people say, well, I filed online and everything was good, and I got my paycheck and everything like that. Well, even when you file online, there's someone on the other side that's supposed to check to make sure your benefit is correct. And unfortunately, because Social Security, their staffing is so low, it was at a 50-year low before Doge and Elon Musk came in. And now I guess it's probably, the final statistics aren't out yet, but it's probably as low as it's been in terms of how many people need to be helped since, 1935. Okay. So here's what we're going to talk about today, the $72 billion in mistakes. So the OIG, the Office of Inspector General, did a report, did an analysis, and they said between 2015 and 2022, Social Security made $72 billion in incorrect payments. And politicians love this stat. They love this statistic. They talk about this is the one, the reasons Elon Musk, we're going to fight this fraud, waste, and abuse. And see, look at Social Security even admits $72 billion. But if you look at it, we're going to look at it. And guess what? It's not what the politicians are using something for their own purposes and using it out of context and use it incorrectly. Go figure. Yeah. Oh my gosh. The world is over, right? All right. So 72 billion. So we're talking about, for those 8 years, about $9 billion a year. That's a lot of money. But Social Security, this year, 2024, Social Security sent out $1.2 trillion in checks. So you figure over those 8 years, about $1 trillion every year goes out of Social Security. Where does it go? It goes to your Social Security retirement, goes to your disability benefits, your survivor benefits, spouse benefits, and all the rest of it. That is less than 1%. Less than 1%. So the current commissioner says, oh yeah, we're going to save Social Security. We're going to make sure your checks are not cut by 23% in 87 months, which they are going to be, according to the Social Security trustees report. That's not going to happen because we are on the ball. We are doing administration, and we're finding the fraud, waste, and abuse, and we're going to save it. And yeah, the only place they're looking is that less than 1%. And let's talk about that less 1%, because yeah, we want to get it down to 0% as close as possible. Absolutely. That's one of the things Social Security employees do to make sure that people are not incorrectly paid. But the problem is now there's no Social Security employees, so that, it's very, very difficult. Okay, so let's make sure you are getting your right benefit, your loved ones, and everybody else. The number one thing I tell anybody once they decide they're going to file, or any time all times in their life, every year, every couple of years, is check your SEQI. What's that? That's your summary query of earnings. Basically what it is, it's your work history. You go into ssa.gov, you set up an account, my Social Security account, and you check to make sure Social Security has the correct numbers. That's how they determine how much your benefit is going to be on a monthly basis based on how much you actually paid into Social Security. And they look over the high 35 years of earnings, not the last 2 or 5, or they look over the high 35 years of earnings. And then they index those based on a wage index, and they multiply them times bin points, 90, 32, 15%, but we won't get into the details there. But the most important thing is to make sure your benefit is correct by checking to make sure what you paid into Social Security is correct. You can fix that. I've done several videos on fixing those records if you find something mistaken. Sometimes those earnings are just in what's called a suspense file in there, but please check. The biggest thing that we found, that I found after doing this about 1 million times, is gap years, where you worked in like 1982, 3, 4, 5, 6, but one of those years showed 0. That's the most common mistake. And what it is, somewhere along the lines, your tax account, and the IRS, Social Security, transposed your Social Security number and they typed it in wrong. And those earnings are out there in suspense. They're kind of floating around out there. So you just have to raise your hand and identify them. They confirm that's yours, and then they put it on there, recalculate your benefits. The problem with not having enough staff is that's one of the things that Social Security employees look out for. If you file online, you think, oh, I just filed online, so I didn't have to deal with a Social Security employee. No, incorrect. Social Security employee has to look at every one of those internet claims and look at it and see if there's any spouses, I'll get to here in a second, any spouses that need to be paid, any children that need to be paid, whether there are any gap years that need to be addressed to see if there are mistakes. But when you don't have Social Security employees on the other side checking all those things, and AI ain't there yet, then you're going to have a lot of people that are underpaid and not getting the benefits they're eligible for, entitled to. So, okay, so there's where some underpayments and overpayments happen. The biggest one, over 50% of incorrect payments, predominantly overpayments, go to people that are receiving retirement benefits and disability benefits and working. You are allowed to work while you're receiving RIB or DIB. My regular viewers know all the acronyms here. RIB is Retirement Insurance Benefits. DIB is Disability Insurance Benefits. So Social Security Retirement Disability Benefits. You are allowed to work and collect Social Security benefits, but there's a lot of limitations. If you're under full retirement age, limited to $23,400 a year. There's a monthly test. When you first start your retirement benefits, you can just do the monthly test, which is $1,950 in the following year. So it's all complicated. Disability is 10 times more complicated, and people get that don't know how to figure that out correctly, and they often make mistakes. I've got another. I'm going to be showing Marjorie Taylor Greene came out and said, hey, maybe, I want to be a unique person and support healthcare. It's like, yeah, welcome to the 90% of Americans. But anyway, I'll get into that in a little bit here. But that is over 50% of underpayments and over incorrect payments from Social Security is people working and not reporting that work to Social Security timely. That's the issue. And then at the very bottom here of my list, this is probably the big thing right there right now with delays. That's going to get even worse. Even if you report your wages to Social Security, who do you report it to? You have to report it to a human being so they can ask you some questions and see what year and does this work actually count? Is it earned income and is it unearned income? Is it an ISM, in-kind support and maintenance? They have to ask you a bunch of questions, determine how to post those particular earnings. And if there's no Social Security employees on the other side, a lot of people get messed up. And then when you get messed up in this particular area, then you get an overpayment or an underpayment. Usually it's overpayment. So you get paid too much, and then you get a nasty grant from Social Security next year or the year after that says you owe us $5,000, $10,000. If you're on disability, sometimes those say you owe us $30,000, $40,000, $50,000. Because even on disability, you are allowed to work. Everybody wants you to go back to work if you're able to go back to work. And so Congress devised a bunch of laws, which I think they're good. They're super, super complicated, but if you look at each particular part, they kind of make sense. But they are complicated, and people just don't understand it. I've got a bunch of videos on that. I've got my website that explains that in English. And the problem is people mess up, and then they work while collecting disability benefits. Again, you can work and collect Social Security disability benefits, but you have to do it right. If you don't do it right, if Social Security doesn't post it correctly, whatever the case may be, there's delays, then you could get overpaid and then have a $10,000, $20,000, $30,000 overpayment. Or sometimes what a lot of people have seen, well, not a lot, but some people see, is Social Security finally gets those records. And then they go back and they say, wait a second, you haven't been disabled from day one. You've been working all this time, yada, yada, yada. So we're just going to cancel your disability from day one, which started 3, 4, 5 years ago. So you have to pay all that money back. So it's important that you report all those earnings, because Social Security eventually does find out. So the key there, what I mentioned is, again, these are $72 billion of so-called Social Security mistakes. But in these particular case, the work, it's not necessarily Social Security. It's the people doing that work that has to report it. So if you're receiving disability benefits, you have to report it and make sure, again, there's no employees out there, unfortunately. Make sure you record that you actually posted that those were posted to your record and confirm, this month you call and say, hey, I'm going to be working on making this much. Here's my pay stubs and everything. Next month call and say, hey, just want to double check. Did I get the trial work period? Am I still on my extended period of eligibility? Check all those little details so you don't get overpaid or underpaid. That's over 50% of the people that get incorrect payments. Okay. Auxiliary, it's called. Another way a lot of people don't get paid correctly is they don't get their spouses, their divorced spouses, benefits from their ex-spouses, their children, child and care benefits. There's a lot of auxiliary type of claims that you can file. So if you have a child under the age of 18 or became disabled before the age of 22, they're entitled to benefits on your record once you start those benefits. If you have a spouse entitled to those benefits, if your current spouse, your benefit amount is twice that person's, entitled to those benefits. If I'm going to go over this one really, really quickly because I've done a lot of videos on spouse benefits and divorce spouse benefits and independently entitled divorce spouse benefits. So I'm not going to go into all the details there, but if you have any special questions, specific questions, make sure you ask them in chat, or better yet, record a video. You go onto my website, mygovexpert.com, and in the lower left, it has a little camera icon. Click that, and you can record a 2-minute question. I've got quite a few of those set up for today. Okay, start date. A lot of people make a mistake in when they start their benefits. There's thousands of videos out there that tell people, if you don't file at 62, you're dumb. If you don't start your benefits at 67, you're dumb. And those people are all dumb for saying any of that because they don't know you. It might be good for their particular situation to start at 62 or 67 or 70 or whatever the case may be, but each situation is different when you start your benefit amount. So a lot of people, because again, if you call Social Security, they can kind of give you some, they can't tell you when you should start necessarily, because that's kind of financial advice. So they're kind of cagey in that response. Congress said, we used to do break-even point analysis for people that says, yeah, you should go ahead and file now, because if you don't, then it'll take you 14 years to make up the difference. Congress said, you can't do that anymore because that's kind of financial assistance. We're going to let the American people, we think the American people are smart and they can make their own decision. So when they go in there, if they say they want to start their benefits on this month, then just go ahead and start it. So unfortunately, you lost a lot of advice there. So that's one of the reasons I do this channel here is to kind of help you navigate that. So if you're working, and I've again done a bunch of videos on this, and I do a live Q&A, and each situation is different. If you're working, under your full retirement age, then there's the work limitations, the monthly. If you have spouses, auxiliaries that you're looking for, that should definitely go into your calculation, whether you're young, a youngish 62 and healthy. If you've got a family, if you've got a good gene pool in terms of, they live forever, then that might be better to delay for tax things. And then a lot of people are making their decisions on when they want to file. It's like, hey, if I wait until 70 years old and I get an extra 24% added to my check, it's not going to make a difference, because Social Security, the trustees say checks are going to be cut by at least 23% anyway. So what's the difference? And so I'm going to just go ahead and get while the getting's good, because it doesn't look like politicians, not only the current administration has zero plan to protect your Social Security and prevent the cuts. And nobody's enacted any plan in 40 years to protect our Social Security. So it doesn't look like, I'm always trying to be optimistic, but it doesn't look like any politicians are going to step up right now and do anything about it, unfortunately. So a lot of people are adding that to kind of their decision matrix to determine when they should start benefits. Okay. Another big overpayment is undisclosed assets. And this only matters for SSI, Supplemental Security Income, which is a welfare-based program that Social Security administers. People think SSI is Social Security. It is, but it isn't. SSI is Supplemental Security Income, a welfare-based, a needs-based program. You have to have low income, low resources. And a lot of people, some people on SSI don't report their wages that they receive on time, and they get overpayments. They don't report assets. When you get SSI, just like Medicaid, food stamps, your first primary home is excluded and your primary car is excluded. So, but if you have any other type of assets, you get another car donated from a friend or, uncle or something like that, you get some money coming in. If you don't report it to Social Security, then you're going to have an overpayment. So there's a lot of overpayments that happen on that. And there was some video out there in social media talking about Social Security is going to be accessing everybody's bank accounts and looking at how much money you have in your bank account and all that kind of stuff. That's all BS. It's only for people receiving SSI, Supplemental Security Income, the welfare-based program. The most you can get on SSI is $967. You have to be disabled or aged, 65 or older. And when you sign up for that program, just like Medicaid or food stamps or anything like that, you give the government authority to check to make sure you don't hit the $1 billion lottery or get an inheritance of $1 million from a long-lost uncle. So you give Social Security authority to monitor your bank account to make sure that doesn't happen, so you don't get overpaid. So as soon as that money hits your bank account, then Social Security system essentially shuts down your check and say, hey, you just got $1 billion. What's going on there? It was a typo, whatever the case may be. So yeah, it's not, contrary to some social media people out there, Social Security is not looking at your bank account if you're on retirement benefits or regular disability benefits or survivor benefits. It's only SSI, Supplemental Security Income. Okay. So if you're receiving SSI and getting any extra assets like that, you're allowed $2,000 if you're single, $3,000 if you're married. You have to report it to Social Security. Another thing is miscalculations, and this one is really going to increase, unfortunately. There are some calculations that have to be done manually by a Social Security employee, Windex, PIAs, Family Max, Combined Family Max. There's some the system just doesn't do, and it has to be a manual calculation. Unfortunately, the people that used to oversee those more difficult calculations, they've been kicked out of the agency by Elon Musk and Doge and the current administration, because they said, hey, if you're close to your retirement, it might be a good idea to go ahead and bail, or and as we used to say in the Marine Corps, they were voluntold. You were told to volunteer to get the heck out. So thousands of people, particularly those senior people that have a lot of experience, those were moved out of the agency by the current administration. And it looks like they're trying to do that again with this government shutdown. So we'll see what happens. But a lot of people are just in Social Security. They're saying well, they've had enough. And if they're even close to retirement, they're just go ahead and bailing, unfortunately. And the miscalculations are going to increase because if you just have a whole bunch of, newer people, you don't have the real great institutional knowledge that those people that work 30, 40, 50 years at Social Security that know their stuff, those people are no longer in those particular offices. So miscalculations, unfortunately, I think are going to increase. Fraud, waste, and abuse is going to increase because most fraud, waste, and abuse, Elon Musk and Doge did not find one penny of fraud, waste, and abuse at Social Security. They made a bunch of crazy allegations, but when it all came down to it, yeah, zero. Big fat goose egg. Who finds fraud, waste, and abuse? Social Security. Well, you do. You report it, and then Social Security employees investigate that. And if it looks like it's something that needs to be investigated even further, they sick the attack dogs, the Office of the Inspector General. Hey, Mike, that was our local special agent. We used to send him out knocking on doors and stuff like that for people, fraud, waste, and abuse. But if you don't have employees at Social Security, then there's going to be more fraud, waste, and abuse, unfortunately, because people are going to take advantage of the fact that there's no employees monitoring the systems there. And as I mentioned, delays. People are going to get delayed getting their benefits, delayed getting their Medicare because of the low staffing, and people are going to get underpaid. Their benefits are not going to start when they want them to start because Social Security employees, there's just no employees there to help out. And remember, my regular viewers know this. You're saying, my office is open. I drove it by the other day and it was open. So don't know what Ed's talking about. Social Security offices are broken up into three different units, three basic units, CSRs, Title II, and Title 16. CSRs are the generalists, change of address, sign up for Medicare, after the fact type thing, SEPs. Title II is what I was. Title II of the Social Security Act did retirement benefits, survivor benefits, Social Security disability insurance, sign up for Medicare, during your initial enrollment period and all those type of things. Title 16 does the SSI, the welfare-based program. So your office might be open, but it might just be full of, generalists, and all the Title II that, you're filing for retirement, all those people, they're gone. They've been, voluntold, to get out of the agency. And so the only people in your office are people that do the welfare program and the generalists who can't help you. So even if your office is open, it might not be open for you, and it might get even worse going forward. Okay, so we went through the list relatively quickly, and let's go ahead and get into some questions, because Social Security, definitely one thing about Social Security is there's exceptions, the exceptions, the exceptions. Let's see, I'm 62. I began receiving retirement benefits in March. I will be receiving inheritance in a few weeks. No relevance whatsoever. If you're receiving just regular old retirement benefits, then, based on your work and you're 62, 67, what inheritance has no relevance whatsoever. So congratulations on inheriting, $1 billion? Yep, no relevance to Social Security at all. It might, in terms of Medicare, Medicare does charge extra for what's called the MAGI, modified adjusted grossed income. So it really depends how you post that to your taxes. You might have to pay more for Medicare Part B and Part D in 2 years. But in terms of Social Security retirement, no issues whatsoever. MTG says she will support Social Security. Woohoo! Thanks for doing your job, March. Yeah, I've got her. She tried to be a lone wolf and support health insurance for Americans. And I'm like, yeah, no, you're not a lone wolf. Maybe in your particular party, unfortunately, right now, but 80, 90% of people want people to have health insurance. So, yeah, she's always playing the victim. I'm a 62-year-old widow and hope to start receiving survivor benefits. I'm still working. My question is, how would the payments work out? I'd exceed the $23,400 in June. It's $23,400. So, in June. Okay, so this is what I talked about in terms of the working there. How a lot of people get their start date and everything is incorrect. So this is a perfect example. Okay, um, so remember, number one, widow's benefits, you can start at 60. So, but you were working, so just want to throw that out there. You can start widow's benefits, surviving spouse benefit, widower, surviving spouse. It's all the same for Social Security. You can start those as early as 60, but you want to start 62, no problem. Okay, so if you go over the $23,400 for the year, the first year, you can switch to what's called a monthly earnings limit. So basically, let's say, let's say you want to start your benefits in June of next year. And for the first 5 months, from January to May, you made $1 billion. That's way over the 23,400. And you're like, well, I guess I can't start benefits next year because I made way over the 23,400. Nope, 100% incorrect. You can start your benefits in June. They only look at June if you tell them that, hey, starting in June, I'm going to reduce my earnings, or I'm going to stop work completely. And starting June, I'm going to stay under the $1,950 for the rest of the year. $1,950 per month, I'll stand to there. So they'll ignore the $1 billion you made before that and just look at how much you make once you start receiving your Social Security benefits. This year it's $1,950. We don't have what the numbers will be for next year, but it's probably going to be about, 2,000 and some change or something. And then the following year, then you have to stay under the yearly limit. You can't switch to the monthly limit again. So, Vicky, I want Social Security disability and I'm 63 years old. My retirement age is 67. Will they automatically switch that over and I just don't tell you anything? You just go to retirement? Correct. So if you file for disability benefits now, you start getting your disability benefits. Once you hit your full retirement age, they switch you to regular retirement benefits. Most people don't even notice the switch. You get the same check amount, the same payday. It's just you're no longer on disability. You may still be disabled, but you're no longer getting disability benefits. You are getting regular old Social Security retirement benefits. And you no longer have any work limitations, and you no longer have CDRs, the continuing disability reviews. I did every time I do, sometimes my regular viewers know why I do kind of shocking, thumbnails and stuff, because we need to get the information out there. A video I did a few months ago said, 300,000 people will be kicked off of disability this year. And that is 100% correct. Hundreds of thousands of people will lose their disability benefits this year because they'll be switched to regular retirement benefits. And so I did kind of a shocking title there. Oh my gosh, I'm going to lose my disability. Yeah, if you're turning your full retirement age, yeah, you're going to lose your disability. And it's like, don't do a shocking title. But I want to reach out to those people because they, my regular viewers know that we get people here all the time. They're 70 years old and they're on disability and they say, yeah, I want to work, but I don't want to get my disability cut off. And we're like, no, you're not on disability anymore. So sometimes we have to play the algorithm game here because the algorithm is all about rage and so unfortunately we are being controlled by computers. We thought we were controlling computers. Yeah, computers are controlling our minds and making us more angry and the rage algorithm. Hey, but these big companies are selling a lot of crap, right? I've been watching and listening to you. I need to talk to you about more than okay. Yeah, I just too busy doing these videos and working on the new website we've got coming up to help people on Medicaid and food stamps and stuff like that. So unfortunately, I don't do private appointments calls anymore. I used to a few months ago, but I have my Jackson. Miss Jackson does those. She's a former Social Security employee. Anytime Congress had any problems with Social Security, she's the one that they called. So yeah, she does the private appointments, and you just go onto my website, mygovexpert.com, and you can schedule an appointment with her. That's the only thing we charge for. Everything else on our website and calling chapter to get help and all that kind of stuff is all free. Cynthia, I was married for 22 years. I got divorced and my ex-husband started collecting SSDI. I was 40 when I started SSDI. I'm 61 now. My ex-husband passed 3 years ago. I remarried at 54. Am I allowed to collect? Okay, so you remarried before the age of 60, so unfortunately not. If you were married at 54 and now you've since divorced from that person, then you can collect surviving spouse benefits on another person's record. But it sounds like you are still married, so unfortunately you will not be able to get benefits on that person's record. So how much is Medicare premium this year? Medicare premium this year is $185. How much is it going to be next year? We don't know yet. But we are going to be starting the annual enrollment period if you have a Medicare Advantage plan, Medicare Supplement plan. If your Medicare Advantage plan has been canceled, about 1 million of those have been canceled, or are going to be canceled by the end of the year. So you need to find something else for 2026. So reach out to someone. And whoever you reach out to, you're reaching out to our partners at Chapter there. They can help you free. They help all people in all 50 states. But you have to be prepared. So you make sure you get everything you're eligible for, everything you paid into all those decades into Medicare. So have your plan, your current plan, if you have a current plan, that way they can compare it with, what's out there available. Have your providers, the name of your doctor that you got to keep, that hospital you got to keep if you have one, your clinic that you got to keep if you have one. So you make sure you find a plan, a Medicare Advantage plan that, covers all those. Make sure you get your prescription so you have those ready. So you make sure you get the correct dosage and you're not paying too much for your prescriptions. If you have a particular pharmacy you want to definitely use, make sure you have the name and the address. If you have any particular priorities, I need more dental, I need to save on CAT scans, I need to save as much money on hospitalization, I need a vision, or whatever the case may be. I've got to keep this doctor. Make sure you have your priorities all lined up there. And have a little patience. If you call on October 15th, anybody, doesn't matter who it is, this is going to be a crazy 2026 season. So you've got from October 15th to December 7th, and your new plan won't start until January 6th. If you have a Medicare supplement plan, you can change that any time of the year and see if you can save some money. You might have to go through health underwriting, but hey, yeah, you might be able to save some money. So. Well, I'm at my full retirement, so it don't matter now. Okay. Yes. Please explain IRMA. Okay. IRMA is income related monthly adjustment amount. So it's basically for high wage earners, or if you sold a home, that counts, unfortunately. Then 2 years later, and there is a logical reason why it takes 2 years, but anyway, 2 years later, your Medicare Part B and Part D will cost you more. There's thresholds. So if you sell a house, if you're single, they exclude $250,000. Anything after that, they add to your taxes. So it's basically based on what you file in your taxes, usually like what line 11 there in your taxes. So it's only for 1 year. So if you get a letter from Social Security that says, hey, because you made a whole bunch more money, 2 years ago, we're going to Medicare is going to charge you a lot more for your Part B. It's not going to be $185 like everybody else. Your Part B is going to be $200, $300, $400 or whatever. If you get one of those and you disagree with it, you can appeal it. It's called it's a form SSA 44. It's called a life-changing event. So let's say you worked 2 years ago and you made a lot of money, and then you go ahead and start your Medicare this year or following year. But you stopped work or you're not making that money, then that's a life-changing event, or you got divorced or there's some other life-changing event. So you can get it waived. And it's only for 1 year. It's not when you're late enrolling in Medicare, if you don't do it in time, there's a 10% penalty for every 12 months. And that you pay that penalty every month for the rest of your life. IRMA, it's only 1 year. If you made a whole bunch of money 2 years ago, then you're going to pay higher Part B and Part D, the prescription drug plan. And then the following year, they're reevaluated. And if you didn't make a whole bunch of money 2 years prior, then they'll just go back to the $185. So Terracotta, 185 likes. Please tap to help the algorithm. Yes, we got to teach this stupid algorithm that, get as much people out there the information is necessary. Can I be paid 1 year retro if I was diagnosed with stage 4 breast cancer? The Social Security can go back 1 year, at least 1 year, or retroactive payments. It depends on your filing date and when you became disabled, when you stopped working, and all those different functions. Yes, absolutely. If you have stage 4 cancer, then if you're filing for disability, make sure you tell them that stage 4 there, and there's expedited processes. There's social internet myths out there that everybody gets denied for Social Security disability at the first time. That's 100% incorrect. There's people that get approved the same day or within a week, and unfortunately, a lot of people have to wait 6 to 9 months if they're lucky to get a decision. And it's going to get a lot worse because Social Security just doesn't have the staffing anymore. So, and that's the point. That's how the whole system was designed by politicians, to make it as hard as humanly possible for you to get your benefits. And that way you just throw up your hands and say, forget about it. Just go ahead and give it to Wall Street. And it looks like they might do better. And politicians, yes, our plan worked. So, but we're smarter than them. I receive SSDI and I'm 58 years old. When I hit retirement age, will I get more of a check above and beyond what the COLA says, or will it be the same? It will be the same. Yep. You'll just be switched over from getting benefits instead of the Social Security Disability Trust Fund. You'll receive benefits from the Social Security Retirement Trust Fund. So it's just a matter of trust fund type stuff. But again, you'll be able to work. Work is no longer any limitations on work, and no more of those annoying continuing disability reviews. Teresa, my full retirement age is 67. I called Social Security and asked about benefits related to my husband who passed 20 years ago. My monthly would increase from $19.50 to $26.58. Will my work income be capped? Yes. Oh, at 67, no. If a lot of people think, well, I'm not getting retirement benefits, I'm getting survivor benefits, or I'm getting spouse benefits, and so the whole work limitations don't apply to me. No, it still does if you're under your full retirement age. But Teresa, you're full retirement age. She's looking very, very young in those sporty glasses there. But if you're 67, then yeah, there is no work limitation. You're full retirement age, and so you can make $1 billion a month, and it doesn't affect your Social Security benefits negatively at all. So, let's see. What about husband Social Security? We divorced. Oh, okay. If you're divorced, if you had to be married to the person for 10 years for a divorce type situation, you have to start benefits on your record first. You have to start retirement benefits on your Social Security. And if that person is at least 62 years old and their benefit amount is twice your full benefit amount, then you can collect benefits on that record. So, what is an ACH? Oh, that's just credit deposit. Yeah. I looked up the acronym one time. It's some technical banking term that they use. I forget. I looked it up one time. What it was. But anyway, it just means a deposit. Our healthcare system is way too complex and in and out of network, BS, et cetera. Just do universal healthcare. We need to elect only people who fight. Yeah, single payer. Billions of dollars go to health insurance companies rather than actual healthcare. So I'm with you. And people say, well, in Canada, you have to wait, we have to wait here too, and get denied prior authorizations. And so is there a perfect system in the world? No, but don't let the perfect be the enemy of the good. My day changed disability came on first, then retirement now comes in the third. Okay. Retirement. Yeah, the pay date, there's a weird thing if you were collecting benefits previously, and sounds like you were on SSI. So yeah, SSI gets paid on the first. If you're kind of grandfathered in, you were receiving benefits previously and on that record, then they take that. But most people, when they're filing for retirement benefits, they get paid on the second, third, or fourth Wednesday, depending on their particular date. So yes, the rage algorithm. Yeah, that's... people found that, they say sex sells, but, these insurance or these social media companies have determined that, rage sells even more. So if you watch a video and it makes you angry, then you watch it longer, or you press like or share it or something like that. And they're like, oh, let's find you an angrier video. and then you just start going down that rabbit hole. And here we are. We are being controlled by computers. So contact chapter for your health insurance needs. This is upper. Oh, thank you very much, Bella. Appreciate it. Yes. October 15th is when you can change, but you can start looking, and particularly those people who, those million or so people that lost their Medicare Advantage plan. There's major health insurance companies out there that decided to drop PPO plans. So if you're one of those, you might be lucky in the sense of now you can get a Medicare supplement plan without any underwriting, a plan F or a plan G, but you just need to see if it's right for you. So you can call chapter there or whoever and say, hey, I just got my letter and it says they're dropping me. And it says here I have guaranteed issue to get a Medicare supplement plan. Is it right for me? How much is it in my particular area? What does it cover? What doesn't it cover? And then at least you can check that out. And if you say, okay, a supplement plan isn't right for me, what do you have for Medicare Advantage? Is there a better Medicare Advantage out there than what I had this year? And they'll look, and if they find something for you, they can't switch it today because it's October 7th, but they can switch it starting October 15th. And you have till the 7th, till December 7th, October 15th to December 7th to switch your plan, and your new plan will take effect January 1st. So my husband was working full-time at 73. He had a terrible stroke. He's getting Social Security, but can he get more since he's disabled? No, unfortunately not. Not from Social Security. Yeah, once you hit your full retirement age, nobody receives disability benefits from Social Security. I always get a comment out there, I'm 70 years old and I'm receiving disability from Social Security. No, you're not. You're receiving retirement benefits because it was switched over when you hit your full retirement age. But I'm still disabled and I'm receiving Social Security. Yes. Social Security doesn't have that magical ability to fix your disability at full retirement age, but they do have the magical ability to just switch where your money comes from. It's no longer coming from the disability trust fund. It comes from just a regular retirement trust fund. So you're still disabled, but you're getting retirement benefits. So this channel must be making a fortune off of Trump. Where was he during the other years? Yeah, I've only been here for a couple of years, and I held Biden's. That's why I put Biden. And you saw in the thumbnail, I put Biden there. I put Bush there. Who else did I put on the thumbnail? Clinton there. I think did I put Clinton on there? But yeah, this has been going on for a long time. And the Social Security Fairness Act that Biden passed, that was terrible. And I still harass him about that. So I am I don't hold favorites. It's all about, well, the only people I hold favorites are the people that are protecting Social Security or Medicare and Medicaid. Those politicians, I don't care. I guess Marjorie Taylor Greene today she's good for Obamacare, the Affordable Care Act, because she's got kids that need it. So I wish she had some elderly people in her family so she would start protecting Social Security. I wish she had some poor people in her family so she could start fixing Medicaid. So these politicians, they only care about it if it hits them. But if it doesn't affect them or their immediate people in their family, they don't give a crap. But as soon as, oh my gosh, I've got a daughter that and so I need to. If you get an inheritance, does that count towards IRMA? It could vary. Yes, it could. It really depends on how your tax account. I don't give tax advice. I try to avoid. I never work for the IRS. But if you get an inheritance, talk with your tax person on that, and it's usually what goes in your adjusted gross income. And the modified part is if you have tax-exempt municipal bonds, if you've got foreign earned income, which usually that's not taxed, but it is included in your modified part of it. So that's as far as I'm going on any type of IRS type stuff. So I just renewed my Medicare today for 2026. I was told Part B will be 206. That's the estimate. They're not coming out with final numbers yet. Yeah, we don't know. So I always joke that as soon as they come out, because people do social media, people love talking about cola, how much cola is going to be. Because a lot of people are interested, so those get clicks. As soon as they come out with the 2026 cola, I'm waiting for the very next day. There's going to be social media people out there making videos about, I wonder what's going to happen with the 2027 cola. So ignore it until it actually comes out. But this year is going to be a little bit different because it's political. Cola has not been political since the early 1970s. But now, unfortunately, it's political again. So yeah. Did everyone get their MedBed cold card yesterday? Yeah. Yeah. Are you kidding me? Is Medicare Part B going to cost 206? We don't know. We don't know yet. Once they come out with the final numbers for Medicare and deductibles and the annual earnings limit and the monthly earnings limit and SGA and all that kind of stuff, then I'll do a video and we'll go over all the numbers. So you make sure you share, like, subscribe, and all that kind of stuff. And that way you can find us again if you are visiting us here first time. Let me see. If you were born in 1959, can you file for Social Security and continue working full-time without a penalty? No, because if you're born in 59, you're full retirement age yet. So you have to be once you're full retirement age, then you can work and make as much as you want. Prior to that, then yes, you have to stay under the annual or the monthly earnings limit. So, somebody looked it up. There we go. ACH is automated clearinghouse. Yes. It's like, is that Publishers Clearinghouse? Did you win who was the Ed McMahon that used to come to your door and give you the $1 million or something like that? Yeah, that's not that type of a clearinghouse. It just means direct deposit. So, what's the difference between, I got a, political type stuff. Universal health care, they would have to pay us back our FICA that we paid in or put us in a different tier according to what we paid in. I want my FICA back. Well, they just use the FICA just to fund universal health care. So, or they use all taxes to fund it. Because remember, I did a video on this a few days ago, how Medicare is funded. Medicare Part A is funded by your FICA tax, what you pay into it. Medicare Part B, 25% of the funding comes from your Part B premium, the $185, and the other comes from just general taxation. So it has, yeah. Why do some oppose universal health care? Do the doctors, hospitals, and politicians? The health insurance companies, they don't like universal health care. And because of it, they start, all the stuff. Oh, but in this country, you have to wait this. And in this other country has this. And so they take the worst the worst situations in other countries. And they say, well, we don't want that in this country. But there are some countries that don't have a waiting, for Canada doesn't have a waiting list. If your doctor says you need this, it's critical. Like in America, if I have a Medicare Advantage, if your doctor says you need this is critical, a health insurance bean counter accountant kind of person can look over that and say, no, that's, we're not going to approve that. You need that prior authorization. They don't have that in Canada. If your doctor says you need it, you need it. If that doctor says, okay, you can wait a little bit, there's other people on the list that are more, that really, really need it really bad. So you have to wait a little bit for it. And so some people say, I don't want to wait for it. So if they have money, they come to America. But if the doctor says you definitely need this, if you don't get the surgery within a week, then you're not going to be here anymore. Then those people don't have to wait. And it's not the insurance company or the government doesn't go in there and second guess the doctor. So is it a perfect system? Of course not. There is no perfect system, but that's why. So, my husband, first wife, passed. They were married 17 years. Can he collect her benefits? No, because it sounds like my husband. So it's your current husband. If y'all remarried after he was 60, then there's possibility. But so survivor benefits, you can collect and be married, but you had to be remarried after 60 years old. If you were married before 60, and you're still married, then unfortunately you're not able to collect those benefits. So, Let's see. Find some new people here. Let's get some questions. And let's show my the video questions. I got a bunch of video questions, so let's listen to some of those.
Hi, Dr. Ed. Thank you for everything you do. I'm glad you're not retired. You know too much information to retire, to share, too much information to share with us still. Anyways, my husband, we live in California. My husband's going to reach his full retirement age in September of 2026. I'm looking at my notes. He does collect IHSS for the care of our disabled son. And I know that the IHSS does count as income because you answered that question for me previously. Anyways, we're going to go ahead and start the application process for retirement benefits to begin January 2026 because I understand that the amount that he can earn is higher, 62,160 from January through August. And my question is, it looks like in the application process it asks if you want to apply for Medicare, but I assume I want to know, will it ask me whether or not we want Part B? I don't want him to enroll in Part B because he's under my healthcare insurance at work. So I want to make sure that that is something that we'll have the option of. Sounds like he'll automatically have to enroll in Part A, though. The other question is, I have an HSA account through my employer and want to know if I will still be able to contribute to my HSA if he enrolls in Medicare Part A. I believe that I can. The HSA is in my name, not his name. So I believe that I can, but just wanted to confirm. So those are my two questions, and thank you so much.
Okay, all right. So yeah, definitely done. They have definitely done their homework there. Because he turns his full retirement age next year, it's no longer the 23,400. It's 62,100. Well, it is for 2025. Next year it'll be 64,000 or whatever. So the year you turn your full retirement age, the annual earnings limit triples basically. And they only count the earnings before your full retirement age, because the month you turn your full retirement age, you can make $1 billion a month and it doesn't matter anymore. So as long as he's under the 62, 63, 64, whatever it's going to be for next year, then 100% good, no issues whatsoever. Nothing's going to be withheld. If he goes over that amount, they'll just withhold $1 for every $3 you go over at the full retirement age. So yeah, it sounds like you did everything there correctly. The IHSS, that is a good program that California, I think Colorado, some other states have, where if there's people disabled that need help, and some smart states have determined that, okay, this person, there's no one there to take care of that person. Have to put that person in some type of facility, and that's expensive. And it's always good to have it, that person in with, loved ones. But sometimes loved ones, they have to, pay the rent and pay mortgage and buy food. They have to work. So these smart states have said, wait a second, we can pay a whole bunch of money to put this person in a facility, or there's somebody that's close by, or anybody that can take care of that person in their home. We like to keep people in their home as possible. That's always the best place for people if they're able to stay in their home. So those particular states pay for a caregiver to help out that person. And if that particular caregiver happens to be a relative, an aunt, an uncle, a husband, a mother, father, whatever the case may be, that's even better, because they'll get even better care. So let's give the money that we would pay the facility, just a fraction of that money, give it to this person as kind of wages to take care of that person. And it works out perfectly for everybody. But technically, why they consider it wages rather than some type of benefit type thing is because that person that's doing the caregiving can actually take care of anybody else. They just happen to be taking care of a loved one. So I think it's a good system across all the boards. And I think a lot of other states should get smart in doing it, but they're not. So, and in terms of the HSA, yeah, because it's under your name, it doesn't affect your husband. His Medicare, he can, when he files for benefits, he'll sign up for Part A. That's automatic. He can't get out of that one. But Part B, you just refuse it. So when you do the application, it says, yep, I don't want Part B. I have creditable coverage. That is coverage under you. You are currently working and your employer has 20 or more employees. So you're 100% good. And then once you stop working next year, 5 years, 10 years, 20 years down the line, then he has to sign up for Part B to avoid those penalties. But for now, 100% good. You're doing the right thing. Done your research.
Hi, Dr. Weil. Thanks for allowing me to leave a video. My question is regarding spousal support. I was married for 34 years and I'm currently 79. I have not remarried and the divorce was final 2 years ago. Both my ex and I started withdrawing Social Security at age 62. He makes about $650 more a month than I. I've been told by Social Security that I am not eligible because we started drawing Social Security at age 62. And also, they say I'm not eligible because I make a little bit more than half of what he makes. Can you answer these questions? I appreciate your help. Thank you.
All right, you're welcome. Yeah, the whole thing about you both started at 62 has no relevance whatsoever. So I'm not sure where that came from, but in terms of the benefit amount, yeah, that sounds correct. Your full benefit amount at your full retirement age, if you would waited till your full retirement age, that's the number they use, and then they use that same number for your husband, ex-spouse, whatever. So your full benefit amount has to be less than half of his full benefit amount. So, but it doesn't sound like it is, and therefore you're not eligible. But here's where mistakes happen. You went into Social Security and a Social Security employee behind the Social Security sign in the official office said you are not eligible for benefits on his record. And that was correct now, or at that time. But remember, that's just because of the way the benefits are calculated. You have to make less than half of that person's. If anything should ever happen to him, those numbers are completely different. You can get, if he's getting $650 more than you, you could get $650 added to your benefit amount if anything should happen to him. So there's a lot of, so please, everybody, please press like, share, subscribe, all that kind of stuff. So this gets out there to as many people as possible, because there's a lot of people out there that are eligible for more surviving spouse benefits, but they don't know they can get them because one time 5-10 years ago, they were told they're not eligible, and which was correct at that particular time. But the Social Security employee should have said, you're not eligible right now, but if anything should happen to that person, you would be eligible. But unfortunately, they missed that other part. And it's going to get even worse because there's nobody left at Social Security, basically. Exaggerate a little bit for effect.
Right. So I think we went this is Billy. I'm asking from Bonham, Texas. I was joined SSI. I was getting $956 a month, and Social Security combined mine and my husband's checks together, and they took out all of mine. Is there a way I can get get my money, get all of my money back? I'm only getting $100, and I can't live on that, and I need your help. Thank you.
Okay. Wow. Yeah, I think just the way the calculation, I wasn't going to answer that question because she said she was from Bonham, Texas, and my high school used to play high school football against Bonham, Texas, and they used to always beat us. So I was going to say, I'm going to skip that question, but no, I'm not going to do that. So in Texas, yeah, high school football is a religion. Anyway, so it sounds like you were receiving benefits, and then you were eligible for other benefits, whether you receive an SSI, supplemental security income, or regular retirement benefits. So it sounds correct. Unfortunately, you're still getting maybe $100 from yours, but the other is offset. So that's unfortunately the way the calculations work. You don't get 2 full checks. You get the higher amount, and then if your benefit amount is lower, you get that amount, and that amount offsets what you receive from that other person. So if I'm understanding your question correctly, that sounds like it's a 99.9% chance that's what we're talking about here. But there might be extenuating circumstances. So in your particular situation, I would probably reach out to Social Security and just tell them, hey, is there any way you can recalculate my benefits to make sure that I'm getting the right benefit amounts? And you can do that it's a form SSA 561, or you can actually do it orally over the phone if you're able to talk to someone. So call the office in Bonham, Texas there. I think there's an office in Bonham, Texas there. So call that office and say, hey, I just want someone to check out my benefit amount to make sure I'm getting the correct benefit amount. And remember, on my website, mygovexpert.com, I also have information on a bunch of other programs for those people living on Social Security alone. I know Texas is like one of the worst in terms of Medicaid. Texas and Alabama are, so many uninsured people. That if you're getting low income, and in Texas it's like $1,000, less than $1,000, it's embarrassing. Other states, your income can be quite a bit more and still collect Medicaid, but it's still poverty level. But call Texas, was it Texas and Human Resources, Health and Human Resources, I think it is, that administers the Medicaid for Texas. Make sure you reach out to them and you're receiving Medicaid, and then you can apply for the Medicare Savings Program, which is if you get Medicaid and they give you the higher levels of Medicaid, they can pay for your $185, the Medicare Part B premium, and that'll put an extra $185 into your bank account. And then there's other benefits for that as well. So make sure you reach out to them. So that's what we're doing with our new website, is helping people get those benefits. A lot of people out there struggling, and it's going to get, unfortunately, a whole lot worse.
If you've been married for over 23 years, do you have to wait till you turn 61 to get survivor's benefits?
No, you do not. If it's a divorce type situation, you had to be married 10 years, at least 10 years. Sounds like you got that, no problem. If you were married to the person, just throw this out there. If you were married to the person when they passed away, you just had to be married at least 9 months. There's a couple of exceptions there. But yeah, you can collect survivor benefits as early as 60 years old. If you're disabled, you can collect survivor benefits. It's called disabled widows benefits as early as 50 years old, from 50 to 59. But just regular old survivor benefits, you can start at 60 years old. Remember, there's still the work limitations. You still have to work, stay under the 23,400 and all that. So.
Hi, my name's Dana and I'm from Delaware. Here's my question. Before I qualified for disability, I had to work. I worked during the waiting period. I was denied twice. So I filed in 2015. I was denied twice. I did not receive information that I qualified until 2018. I went to go back to work from, being on disability, the trial work period. They told me that my trial work period was already done. It was done during 2016 and 2017, while I was waiting to find out if I ever even was going to qualify. I was denied twice prior to finally in 2018 qualifying. Now they're telling me I have no trial work period because it has already been done, because they already back paid me for that. But I was never given information any way that if I went to work during that waiting period, I was trial work perioding, basically. So just wondering, because I'm sure maybe this will come up somewhere else in someone else's issues, but trying to figure.
Okay. All right. Yeah, that's a complicated one. So it depends how they coded it when you first filed originally. So it sounds like if I'm getting this right, you originally filed and then you went back to work because you need to go back to work. You need to pay the rent and all that kind of stuff. But unfortunately, Social Security defines disability as inability to work. If you go back to work and you make over, the limits, then they'll say you're not disabled, even though, remember, Social Security itself was started by FDR, guy in a wheelchair, polio. Social Security would not consider him disabled. He is disabled outside of Social Security, but Social Security defines disability as inability to work. When you work, doesn't matter how disabled you are, Social Security that says you're not disabled. That's just, it's not Social Security that says that, it's Congress that says that. Social Security just administered those regulations and those laws. But in your particular case, if they originally, back many years ago, we're looking at your case and then say, no, we're denied because you're working, then that's it. It's not a trial work period. But it sounds as though they either proved you and then did the trial work period, but something just doesn't make sense. So you need to file an appeal on this. And hopefully someone in Delaware, there is someone in your office that's, a technical expert on this and really takes time in looking at it. But unfortunately, with all the staff cuts, it's difficult. But they really need to look back and see if those trial work period months were actually allocated correctly back in 2015 or 2016. So tell them that it's an SSA 561, and you're saying here, I never used my trial work period those years. It shouldn't have been trial work period. I worked and they just denied me because I was working. It wasn't trial work period because you only get those 9 months, basically once. So I think they might have coded it incorrectly, possibly. They'll have to look at your particular record. And if they determine, oh yeah, you never used your trial work period, then you have those 9 months available to you. So I would do the SSA 561 and tell them that. And on the front page of the 561, you just type in or write in "see attached," and then attach a letter to it and explain your situation. Try to make it as short and sweet as possible. But anytime anything like this happens, I always look cautionary tale. If you're currently receiving disability benefits and you're disputing something prior, whether it's your start date or whatever, I just want to throw this out there that there is a possibility if someone else goes in there and starts looking at your record, they might another person to reevaluate it and says, oh, I need to look out for this. Wait a second, this person should have not received benefits, shouldn't be disabled. So there's always that chance of another person that looks at it might make a completely different decision that you might not like. So unfortunately, there's always that chance. So I just want to throw that out there.
Hey, Dr. Ed, thank you for helping everyone. Your channel's awesome. My question is, I received Social Security SSI. I was receiving nothing but SSI. But when I hit 62, government made me take my Social Security, and I get some SSI supplement. I get some of that too. Almost $200. Anyway, what I'm asking you about, I've heard you talk about them cutting our benefits if you took it early. Can you explain that? Did they already take that, or are they going to take it out of my check?
Okay. Yeah. So it sounds like everything was done right. If you're receiving SSI, supplemental security income, and you're receiving it because you were disabled, and then because it is SSI, that money doesn't come out of the Social Security Trust Fund. It comes out of regular general taxation. And part of Social Security's job is to make sure, money isn't taken out of general taxation. So once you are eligible for any other benefits, retirement benefits, spouse benefits, divorce spouse benefits, whatever the case may be, you have to take those benefits. And I know a lot of people say, but yes, I'm on SSI, but if I take my benefits at 62, it's reduced by 30%. But if I wait until my full retirement age, I won't need SSI at all because my benefit will have increased until then. So if it'd be better for me to wait, I'd get more money, and then I wouldn't need general taxation SSI anymore. Yes, that makes completely 100% logical sense. But the way Congress wrote the law is that as soon as you're eligible for any other benefits, you have to get those other benefits. So that's what happened. So you're receiving SSI and retirement benefits on your own record. So that's unfortunately how the system works. And remember, if you're eligible for any other type of benefits, spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits, surviving spouse benefits, you have to file for those benefits as well. But because you're receiving SSI, then you get Medicaid. You don't get Medicare being on SSI. If that's all your benefit is SSI, the retirement benefits, you're just getting retirement. You're getting SSI disabled and just regular retirement benefits. So in terms of Medicare, you won't be eligible for Medicare until you turn 65 years old. So
This is Rose from Hawaii. I have a question, Dr. Ree. When a deceased spouse dies, and my husband and I wasn't living together for health issues related to mental health on my part as well as his. When it comes down to the lump sum death payment, is it allowed and what is the rules on it? That's my question.
okay, so that's that lovely $255. It's embarrassing. That the burial insurance, $255, has been like that forever. So that's one of the reasons I've partnered up with these guys. If you need burial insurance, give them a call. Final expense, they also call it. So if you're on that person's record and that person passes away, and here's how it works. So if you're receiving spouse benefits or anything like that, and $1 from that person, then you're on that person's MBR. Elon Musk didn't understand what that is. So Elon, call me and I'll tell you about the whole, all the millions of people over 200 years old receiving Social Security. I'll straighten you out on that. So he doesn't understand Social Security. That's how he's making all these incorrect statements. Okay. But if you're on that person's record and your addresses match almost perfectly, when that person passes, you will generally get automatically converted to surviving spouse benefits, and they pay out that lump sum death payment, the $255. If you're living separately, because that burial insurance, the $255, the burial benefit, is supposed to go for the burial. But if you're, estranged, not living together, whatever the case may be, then you probably didn't have to pay for the burial or anything like that. So that's how that whole thing works. But if your addresses were just different temporarily because of, whatever, but, you were still looking out for each other and still, and you, you were involved in the burial and all that kind of stuff, then you're still married, then that $255 had to come to you. It just didn't come to you automatically because your addresses sound like they're different. So you might be eligible for that $255. It's the regulations on it, you just have to prove that, yes, we were living kind of apart, but that's just because of a particular situation. But we were taking care of, each other's most basic needs, including what happened. So just have to make that case.
Good morning. I just ran across your website and I'm enjoying it.
Good.
My question is, my wife is 66. I am 61. And I was told she can't collect retirement until I turn 62, but I will still be working. She's not worked enough to ever collect on her own. Is that true? Or do I have to retire for her to start getting retirement, which I don't plan to retire till I'm 65?
Okay. Yeah, that sounds true. So she is not eligible for benefits on her own record. So she can't start her benefits at 62 or whenever because she just didn't pay into the system enough. But that doesn't affect her getting spouse benefits. But because you're currently married, you do have to start benefits on your own record. So once you start benefits on your own record, then your wife can start collecting benefits on your record as well as a spouse. But until then, unfortunately, no. And also, if she hits 65 and she's eligible for Medicare, she has to file for Medicare. She has to get Medicare. Part A has to pay for it. Part B has to pay for it. Everybody has to pay for it. And even if she's not eligible because she didn't pay into it, she still has to pay it. If she doesn't, then she gets penalties. And then once you file for benefits, then that penalty will go away because, you'll get it off hers.
My question is how to get Social Security statement and what to do when they denied my Social Security pension. They want me to send all the forms filled up and papers that I don't have because I lost all my records, and they make it clear to me if I don't send everything, including the hours, employment, job, working employers, and so on and so on, that they will deny me. And I called Social Security in USA, and they told me, well, you started in Athens, Greece, because you live in Serbia, so you have to finish with them. There is no need to come to USA. So I'm in a big problem because they gave me deadline October 10th.
Okay. Yeah, if you can file for retirement benefits overseas, disability benefits overseas, any benefits, and you normally the process takes way longer than it does if you did it in the United States, because you got to go through the federal benefits unit or your local U.S. consulate or American embassy or something like that. So the whole process does take a long time. But it sounds like they're working on it, but they need documents. If you're filing for disability benefits, they need to know your work history and your doctors and your medical records and all that kind of stuff, and your citizenship or your green card status or whatever. You have to provide all the documentation. And if your case is being, I don't, you can file in a particular, outside the United States of the federal benefit unit, but once they get all the documents, then they send that back to the Office of International Operations back in the United States, Baltimore. And then, you can discuss it with them, but they can't do anything. They can't send your complete packet back to the United States until they get everything. So yeah, you have to provide everything. So it's just part of the process. Everybody does.
Hello, Dr. Weir. Thank you so much for your services. The knowledge that you share and provide for people is really helpful and beneficial for a lot of people who, as you say, are not aware of resources available to them. I have a loved one who is receiving SSI. He's not of the age of 60 yet, and he's been on disability for a long time. I'm not sure if it's SSDI or SSI, but I've approached him about HUD housing to get help with his rent that he is paying out of his SSI check. And he is very cautious of that and doesn't want to do that because he believes that HUD, if he receives an amount from them for rent, that amount is going to be deducted from his benefit, which would wipe out his benefits pretty much because, rents can be $1,000 or more. Can you speak to, and I'm happy to hear, by the way, that you're adding additional information, additional websites, a community, as you said. Can you speak a little bit about the relationship between a HUD uh, uh, benefit and your SSI benefit?
Absolutely. Okay. So, yeah, it's confusing because sometimes that housing assistance does count and sometimes it doesn't. But number one, thank you for looking out for those people around you. You are officially now part of our community. Anytime anybody looks out for people around them, they officially become part of our community. So thank you, thank you, thank you, and welcome aboard. So for HUD, that's a federal benefit. So that does not affect his SSI in any way, shape, or form. So it doesn't, he's not going to, his SSI won't be reduced by $1 because it's HUD, Section 8 housing. Any type of federal benefits like that doesn't affect your SSI, supplemental security income. If he was going to get rental assistance from some other place, a friend, or you're going to give him, $400 a month or something like that, then they count that differently. And they used to count it completely different up until about a year and a half ago. They changed the policy. It's called in-kind support and maintenance, where they don't count it against people like they used to if you're providing rental assistance and food assistance. Before, there was like, it really counted against you, but they changed that. But in his particular case, it doesn't matter whatsoever. HUD does not affect SSI at all. So just tell him that. It says, yes, you're right. If you get rental assistance, it will affect your SSI unless that rental assistance is a federal subsidy like HUD. That one doesn't count. And you can call, if he's kind of paranoid, he can call any office in the country and say, hey, I need to talk to an SSI person. Don't let the people that don't answer the phone answer this. So I need to talk to a Title 16 CS, Title 16 of the Social Security Act, SSI. And I just want to know a simple thing is I'm thinking about getting HUD. Will that rental assistance affect my SSI? And they'll say no. And that way he'll get the peace of mind and go out there and get those benefits because you got to get on the list as soon as possible. HUD, it's terrible. That's one of the biggest issues in the country, health insurance and affordable housing, particularly for seniors. We definitely need to address that. And HUD, the waiting list is years.
Hi, I'm inquiring about the possibility that I could get the Social Security benefit that my ex-husband received. He passed away August 17th, 2018. We have two children who are adults over the age of 22. We were married we were married 13 years. He remarried and divorced. I remarried and I'm still married. Both me and my husband receive benefits. My benefit is $2,335 per month. So I'm just checking to see if either me or my two children, again over 22 years old, can receive the benefit he received.
Okay, so you're still married. So if you got remarried before the age of 60, then you wouldn't be eligible for those survivor benefits. In terms of children, the only time children can receive benefits from their parents is if their parent is receiving retirement benefits, disability benefits, or they're deceased. And the child can receive benefits if they are under the age of 18 or if they became disabled before the age of 22. So that's pretty much the only time they can receive those type of benefits. So it doesn't sound like, depends on when you became married and also the benefit amount of that particular person, your deceased spouse. So it really depends on that, whether you can get those benefits. All right, we got one more question here, and then we'll talk about Marjorie Taylor Greene.
Information on caregivers benefits for Social Security. My husband has a child under 18 that is my stepchild, and you mentioned in one of your previous recordings that I would be eligible for some benefit. We are both Social Security age and both currently are receiving Social Security benefits.
Okay, so Yeah, this is called child in care benefits. So if you have a spouse that's collecting benefits and they have a child collecting benefits off that person's record, and that child is under the age of 16 or became disabled before the age of 22, then you can collect what's called AUX, or surviving child in care benefits. Child in care benefits is basically because you've decided to, not go out into the workforce because you have someone that's, young or disabled that needs to be taken care of. So those child and care benefits. So you're limited to the amount of money you can make in terms of earnings and stuff like that. But yeah, I would, and it also, it goes up until you hit your full retirement age. So if you're already receiving benefits off your spouse and you're your full retirement age, you might not be eligible for it. But so it really depends on a lot more questions there. So I would call Social Security, and again, on this particular thing, I would probably schedule an appointment. Schedule an appointment to file for child and care benefits. And that way, an actual, rather than the people at the front line, you actually talk to a Title II CS, a Title II of the Social Security Act, Title II of the Social Security Act claim specialist, and they can check and see if you're eligible for the the auxiliary child and care benefits. I would definitely do that. And then if you're not, then you're not, but at least you know what's going on. So, all right, that is it for the video questions. And yeah, came across this today, and I just wanted to parse this out. And Marjorie Taylor Greene, she did a congressional hearing a few months ago about, the wait times at Social Security when Biden was president, and was it Clay Higgins from Louisiana? He was on the phone. Look, I'm on the phone for 3 hours. And yeah, they don't care about it anymore because it was all politics. They didn't care how long you were waiting. Okay, so let's talk about this. I was not in Congress when all of this Obamacare, Affordable Care Act BS started. Wow, quite a mouth on her. Make an old Marine Corps sergeant proud. I got here in 2021. As a matter of fact, the ACA made health insurance unaffordable for my family after it was passed, with skyrocketing premiums higher than our house payment. Well, the Obamacare, the Affordable Care Act, is not this thing. It's just laws that were passed that said health insurance companies could not discriminate against you if you had health, if you had what in America we call pre-existing conditions. So health insurance, you remember the old stories where you'd have, we'd see it every single month. Some little boy, 10 years old, get cancer or something, have to do a surgery, but the health insurance company wouldn't give them a health insurance because they could discriminate against people for not being human, sometimes being unhealthy. And that's what the Affordable Care Act did. It said, you can't do that. You can't discriminate people for being unhealthy. So, and it said you had to provide basic services like, OBGYN and stuff. So some plans didn't do that. So health insurance companies, obviously, said, okay, oh my gosh, we used to cherry pick and, get the youngest people. And we used to make tons of money, but now we have to insure everybody. Oh my gosh, this is terrible. So they raise rates. And the solution for that is, okay, how we will solve that is we'll make everybody get health insurance, just like we make everybody get car insurance. And someone responded back on this. Let's see, something about, Americans don't want to be forced to buy something they don't need and forced to pay taxes to provide health insurance from someone else. I don't want or need insurance as I'm a healthy adult. This person doesn't know the whole concept of insurance at all. Number one, you're paying car insurance for other people having accidents, and hopefully you don't have an accident, but that's the nature of insurance. Ensure event doesn't happen in the future. So I don't need health insurance because I'm a healthy adult. Okay. So when you become unhealthy and you're diagnosed with something terrible, then you want to go to the health insurance company. You know how long those health insurance companies would last? That was yeah. So this person just doesn't understand the whole nature of insurance. And I don't think Marjorie Taylor Greene, one of our politicians, understands it at all. So, and that's what the debate in the shutdown is right now. To give everybody health insurance, even the people that are sick. Yeah. People that are not sick need to buy into it. And so that's where the mandate came in. They got rid of the mandate because they don't want to be forced to do stuff. They got rid of the mandate. And so the government had to step in, and because the insurance became even crazy more expensive, so the only alternative was the government to come in giving those premium tax subsidies, the advanced premium tax subsidies, where they help you if you need help paying for your Affordable Care Act. Okay, so that was the alternative. And now, as part of the one big beautiful bill, they said, no, we're not even going to help that. So now, because she has someone in her family that's affected, now it's an issue. Yeah. So I wish she had a poor person in her family or a senior person in her family so she would get on the. Anyway, so nice. I'm not a fan. Well, sounds like she is a fan, right? But I'm going to go against everyone on this issue. He's such a martyr. When the tax credits expire this year, my own adult children insurance premiums for 2026 are going to double, along with all the wonderful. And all those and all you other people too. Now I'm not towing the party line on this or playing loyalty games. You're supposed to be loyal to the American people. But anyway, I'm a Republican and won't vote for illegals to have any taxpayer-funded health care or benefits, which nobody is. Yeah, come on. The whole, one side is not telling the truth if, says, hey, we need to give, the Medicaid cuts are going to hurt people. The ending of the Affordable Care Act subsidies are going to hurt people. The cutting of Medicare is going to hurt people. Health insurance that can't take that hit. And the other side says, you're just giving people, illegals, undocumented immigrants, health insurance. No, that's not in there. In order for that to happen, Congress would have to write a brand new bill because it is illegal to give undocumented immigrants the Affordable Care Act, Medicaid, Medicare. It's illegal. It's been illegal for decades. And people say, well, they do get it. Well, emergencies under the Reagan administration is called EMTALA. If you go to the emergency room, they don't check your legal status in this country. So if you look Canadian, whatever that means, they don't check to see, well, you don't look like a real American. You look like you might be from Toronto or someplace or, Mexico or Japan or whatever the case may be. So before we stop that bleeding or, resurrect you, we need to check your legal status and, check with the INS to make sure that green card is, correct and everything like that. And so, no, they don't do that. They fix you. And then if it turns out you don't have insurance, you're an American citizen, you don't have insurance, which is the vast majority of the time, then the hospitals get stuck with it. And a very minimum amount of time, it's people that are not in this country legally. But so in order to solve the issue of just a few undocumented immigrants receiving emergency care, they're going to require everybody. So you need to carry your passport, your birth certificate around at all times. Your driver's license doesn't work. What's going on? It's crazy. Well, sometimes it depends if you have the new driver's license, I guess. So I'm carving my own lane. Yeah. Your own lane with the other 80-90% of Americans. And I'm absolutely disgusted that health insurance premiums will double if the tax credits expire this year. Well, okay. Yes, we're on the same page. Vast majority of Americans are on the same page. You should have added on there. Absolutely disgusted that people are going to lose Medicaid. Absolutely disgusted that, Medicare is going to be cut by over $500 billion because of the Pay-Go Act. Yeah. Also, I think health insurance and all insurance is a scam, just to be clear. Me and her 100% agree on that one. Yeah, I agree 100%. For that type of necessity, for health insurance, I don't think big for-profit health insurance companies should get in there at all. But that's not the reality right now, unfortunately. So not a single Republican in leadership talked to us or about this or has given us a plan to help Americans deal with the health insurance premiums doubling. Well, not according to your leadership. They're working on it 24 hours a day. So someone's not telling the truth here. Yeah, and everybody knows, not sure where she's been. Our country sent $30 billion to Israel, 2024 alone, into Ukraine, all these different places. And this is an old chestnut that always given out, which finally has been proven to be 100% incorrect. Politicians have been used that to distract people for decades. People say, hey, we need better Medicare. Hey, we need better Medicaid. Hey, we need better roads. We need better yada, yada, yada. And then politicians say, yeah, I agree. As soon as we stop giving all this money to all these other countries, then yeah, we'll use that money in the United States, which is always BS. And most of us knew it was BS. And now we can prove it was BS because the current administration cut off funding to other countries. A lot of other countries are going to suffer, and China's going to move in there and make really good friends, and we're going to be screwed in the long run. But anyway, so they cut off that funding. And so did you get a whole bunch of extra money in your pocket? No. Where did it go? Of course, we know where it went. It went to tax cuts for the super wealthy and giant corporations. So our country does good in funding foreign countries and foreign wars, and never does anything to America. Yeah, so now that we cut it off, we're still not doing it because that was never in the intention. That was just a distraction. So it is absolutely shameful, disgusting, and traitorous that our laws and policies screw the American people so much that the government is shut down right now, fighting over basic issues like this. Yes, duh. Again, no funding for illegals. Come on, stop. That's not an issue. I think nobody believes that anymore. There's probably 3 or 4 or 5% up there that still believe it. But yeah, it's never been about undocumented. That's always been, the distraction. So you don't hate your government enough. Well, you're in charge of our government. So I'm here in Washington, D.C. this week to meet with anyone who is America only and will work with me on a plan for Americans only. Well, yeah, that's what they're trying to do. That's why they shut down the government. And the entire intent is to restore the cuts to Medicaid, to restore the subsidies, and get people health care. So I guess welcome to the party. Where have you been for the last many decades? All right, so there is that. So hopefully she will show the same amount of motivation to help out people. Hopefully she can find an elderly person in her family that can't sustain a 23% cut to their Social Security. So if she has someone, or these other politicians have an elderly person in their family that says, hey, in 87 more checks, they're going to get a 23% cut in their benefits because the Social Security Trust Fund is running out, and 40 years of failure by these politicians, we need to do something to fix that. So hopefully her and the other politicians can find someone in their family or find someone in their family that is dependent on Medicaid in a nursing home. Majority of the people on Medicaid that are elderly are in nursing homes, and the nursing homes get Medicaid, and that's going to be really, really hurt going forward. So these politicians, it seems like they don't care unless it happens to someone immediately in their family. So these issues have been going on for decades, and now she just saw the light because it affected her. So yeah. Anyway, all right. So so we just did the live Q&A, and we went way, way over. If you got any questions, remember you can join me tomorrow. I'll be back again tomorrow, 3 o'clock West Coast time, 6 o'clock East Coast time, where I'll answer any of your questions on all things Social Security, retirement, disability benefits. And if you want to do a video, make sure you go to my website, mygovexpert.com, and record. You can record up to a 2-minute video. I'll show the video, and then I'll answer your question. Or if you have any type of comment, then make sure you join us. And the comments keep coming in. All right, y'all take care. Have a beautiful night. And please, 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 please take care of each other.